not so great of an option. Okay, so if you are a 180 practitioner, hopefully your response to this poll was, I wouldn't get rid of manual therapy, because you would be doing 180 system patented manual therapy, which increases neuromuscular function. So we increase range of motion, active range of motion, we increase strength, we increase ability to get in and out of provocative positions. So that should have been the right choice. So why not exercise? So what I tell people is 180 system is partially manual therapy, partially exercise, but it's never corrective exercise. So remember, if somebody's coming into your clinic with dysfunction and they can't do things, and you give them active range of motion, eccentric, concentric muscle contractions, you didn't get to the root cause of the problem, which is neuromuscular dysfunction. So if neuromuscular dysfunction is still there and you give them exercises, what happens? Pain increases, swelling increases, guarding and lack of range of motion increases. You're not helping them by just giving them exercise. Remember, if exercise solved problems, people wouldn't get hurt while they're doing exercise. Why do they get hurt when they're doing exercise? Because they have neuromuscular inhibition, which means they have misfiring of the muscles that should be moving and stabilizing the joints in those positions. Therefore, they have to compensate with other muscles. Now they have compensation patterns, which puts wear and tear on connective tissue, ligaments, tendons, bone in some cases. So that's how they get dysfunction and symptoms in the first place. So if you're just giving them exercise for patellofemoral syndrome, let's do squats, let's do lunges. Oh, those hurt? Well, let's only do partial range of motion. Does that make any sense? Could I teach a run-of-the-mill 8th grader to give people exercise, and if the exercise hurts, just decrease the weight or decrease the range of motion? You bet I could. You don't have to be a doctor of anything to give people exercise and modify exercise, okay? So now, if you're a 180 practitioner and you understand all that, then like I said, your choice should have been, I would never get rid of the manual therapy, because that's what's going to, of all those choices, that's the only thing that's going to get to the root cause, which is neuromuscular inhibition, reverse the inhibition of all the muscles that are inhibited. Then we go do reinforcement exercises, which means we're allowing their body to function normally, because now all of those muscles are online. Nobody's inhibited. Now we can go through a full range of motion with as much resistance as they can handle, and we have no symptoms. We have no increase in swelling. We have no increase in guarding. We have no loss of range of motion, because we've made them physiologically optimal so they can go do things through a full range of motion with transverse plane range of motion, with no tape, no braces, no orthotics, and they're completely fine. So, long explanation for the story yesterday. So, if you're not understanding what I'm saying, post questions below. If you understand what I'm saying and you're like, yeah, that makes total sense, I wish I knew how to do that, I can teach you how to do that in less than 4 months and change your career, so you can take all of the modalities and throw them away. So when people come into your clinic and they say, well, I've already gone to the chiropractor and he did cupping, and I already went to the physical therapist and they did needling, and I already went to the athletic trainer and they did K-tape, and I still can't do what I want to do. You can say, this is why K-tape failed, didn't get to the root cause, has absolutely nothing to do with neuromuscular function. This is why cupping failed, totally bogus, not supported in any type of thought process or in science. Dry needling, guess what? Trigger points don't exist. Read the research, read your neuromuscular physiology. Doesn't happen. Do muscle spasms occur? Yeah. But remember, needling doesn't get rid of muscle spasms. You're treating trigger points, which even the people that invented dry needling can't find trigger points. Why? Because they don't exist. So you can get rid of all that stuff and tell your patients, this is why we don't do those things. This is how I'm going to assess you. So we get down to the root cause. This is how I'm going to reverse your dysfunction so you can do what you want to do. And these are the easy things that I'm going to give to you to take home, which will help you get better in between visits and get back to what you want to do after one visit rather than 2 to 3 times a week for 6 to 8 weeks of wasting your time. So you can explain why you don't do modalities. You can explain why the exercises that the orthopedist gave them, oh, you have patellofemoral syndrome. Here, do wall sits and VMO knee extensions. Do you think that's going to work? No, those are idiotic, even after you've refacilitated things. What you're going to do is say, this is why the exercise that you're doing is actually making you worse, which is why they're non-compliant with other people's home exercise programs. Here's what I'm going to do. I'm going to turn all this stuff on for you, give you all the ability that you need, then give you the things to do at home to keep what we did here, and you can keep moving forward. Okay? So I can teach you all that thought process, all the steps that goes through that, all the way from the functional screen to the actual hands-on treatment, to the patient education, to the exercise programming and progression, and you can be an expert in that in about 4 months by getting in the membership. So if you have questions on that, DM me and let me know. Talk to you later.